Let me tell you all about Dr. Heather Finley. She's a registered dietitian with a doctorate in clinical nutrition. She helps people struggling with bloating and constipation and IBS find relief from their symptoms, feel excited about food again. She also has significant experience in the eating disorder world and treating patients with eating disorders, as well as those who have all of those bloating, constipation, IBS issues that may or may not be related to eating disorders. She's a lovely human and my friend, and I'm so happy to introduce her and turn the time over to you, Heather.
Thank you. I'm so happy to be here. I feel honored that I get to start the year with you for this webinar series. So I appreciate you being here. It looks like we have almost 600 people, which is so exciting. I wish I could see all of your faces, but I know that that is a little bit more logistically, requires a bit more coordination. So really, really happy to be here. Thank you for spending either your lunch break with me or your drive with me or whatever you're doing. We, like Tamara said, we have quite a bit of information to cover. I am available for questions after. I have some slides where you can learn where to reach out to me, but we will go ahead and just get started. Like Tamara mentioned, feel free to put any questions in the Q&A, and I hope we have some time to do some questions at the end. But I want to just start off with a story that I'm sure many of you can relate to. I was in private practice prior to doing what I do now, which I'll share more about in a little bit, but I was in private practice for about 10 years, and I have many, many stories to share with you about clients, but there's always this one client that stands out to me. She came to me, she had been to multiple treatment centers, she had seen multiple providers, you know, all the GI doctors, all the things. She felt like she had kind of done everything, and she plopped down on my couch and she just started crying, and she said, I think I am just going to be like this forever. She had terrible stomach pain every time she ate. She was super bloated, really constipated. And honestly, it was not even the symptoms really that were the biggest issue. It was all of the mental health challenges that were going along with it. She felt so hopeless, and really felt like she had kind of reached the point where I don't know if anybody can actually help me. And honestly, I related to her so much because that's part of my story as well, struggling with GI issues. And I'm sure with the amount of participants we have here, maybe you relate to this also, feeling like you've tried everything. Maybe you don't personally relate to this, but maybe you've had tons of clients like this over the years. And so that's what we're really going to be talking about today. After seeing this client and hundreds of other clients just like her, I really decided no clinician should feel like they don't have the tools to help a client succeed due to co-occurring GI issues. Having an eating disorder is hard enough, and then you add in GI issues like IBS, and it's just a recipe for a lot of confusion, a lot of struggles, and there's nobody really bridging the gap between these two things. And so that's what I set out to do, is to help people understand how this all goes together and empower you as the clinician to be able to help your clients, because there's really nothing worse than feeling like you don't have the tools. So I'm hopeful that today we can go over some of those tools. I am sure I've seen some of your names before, as this is not the first webinar that I've done for Center for Change. So you're welcome to go back and watch some of the past webinars as well. There's lots of tools in those also. But this is not news to anybody. Co-occurring GI issues can negatively impact the treatment process, and we're going to talk a lot about that today. So some of the things that you may see in your practice: increased food fear. Nobody wants to eat if their stomach hurts all the time. Nobody wants to eat if they feel bloated, if they haven't gone to the bathroom in 7 days, if they're having to use suppositories to have a bowel movement. I mean, honestly, the list could really go on. More medications, you know, so they're taking medications maybe for mood or anxiety or whatever it might be, and then they're taking medications for their GI issues, and they just feel like they're kind of stacking up the medications, and that can be challenging all in itself. Food refusal, I know this is common, kind of going along with the food fear. Nobody wants to eat if they feel like they're in pain all the time. Just overall non-compliance. Honestly, as a clinician, that really affects your confidence as a clinician. I remember working with so many clients and still to this day working with clients. And when someone's not compliant, you can take that on, and that can just create more anxiety and stress about doing the job that you're supposed to be doing. And so nobody wants to feel like that. Worsening stomach pain, and then GI symptoms of all kinds. I mean, we could spend an hour even just talking about all of the symptoms that our clients experience, and how hard it is on them. So I know that Tamara already introduced me, but my name is Dr. Heather Finley. I am a registered dietitian. I am a gut health specialist. I mentioned this before, but I struggled with my own digestive issues for about 20 years, and it really affected my relationship with my body, with food. And I, like I said, set out on a mission to make sure that nobody else has to go through this struggle. And so it's my life's passion and work to really help individuals find relief from digestive symptoms so that they can love food again. One of the things that I saw in the space and honestly made me feel even more hopeless was that if you have gut issues, then you need to do this restrictive diet. And I just felt like there has got to be another way. There's got to be something else that can help clients. And so I was in a brick and mortar private practice for about 10 years until I transitioned online. And now I run a program called Gut Together. It's a program that helps individuals with GI issues. And I also am the founder of Gut Practitioner. This is a training program for practitioners wanting to learn how to help clients with GI issues, so that they can feel more confident. I'm the host of the Love Your Gut podcast. And then I, about a year ago, actually published a book. It's called The Healthy Happy Gut Cookbook. And so lots going on. Really happy to be here and share this with you. So just want to kind of set the scene here. One study found that in a survey of women diagnosed with an eating disorder, about 50% met the criteria for IBS and 98% met the criteria for at least one functional gut disorder. And this is just one study, but there's many others that I'll share with you today. But I imagine if you're here and you have a practice or you work in treatment, or whatever you do related to eating disorders, you've seen at least one patient with GI issues. And I bet the number is definitely greater than one. And so just want to talk first about some of the potential impacts. So when someone has IBS or when they have GI issues, this can affect their food tolerance. They eat, they get bloated. They might feel like they have tons of food sensitivities. And I put that in quotes just because there's so much misinformation about food sensitivities out there. They might have lots of painful and disheartening meals, especially if you work in the treatment setting. This can be really hard to just navigate this with clients. They might struggle with their motivation and mindset. If they're not feeling like they're getting anywhere, they feel like, okay, no one can help me, or nothing has worked thus far. That can be a really hopeless place to be. And so it may impact their motivation to even recover if they're not feeling well. And overall, we just see that when someone has not only an eating disorder, but also GI issues, it just overall makes it harder on recovery. And so hopefully today we'll give you some insights about what we can do. And so just want to start off by sharing a couple studies with you. So this first study is a study on mental health among university students that had eating disorders and IBS. And essentially what this study looked at was the significant link between eating disorders and IBS among these students, and the physical and mental health challenges. And so what this study highlighted was just the heightened vulnerability of students that have both of these things going on, and some of the unique challenges that they may encounter along the way. And so it's interesting to look at studies like this because I think it shows that you can have physical symptoms, but they also affect your your psychological health. And so although, yeah, you might have stomach pain, how is that actually affecting your anxiety, your overall well-being? And so how are we actually bridging the gap between these things, and what interventions can we provide to our clients here? The second study was looking specifically at eating disorder quality of life and functional gastrointestinal disorders amongst eating disorder patients. And so, what this study found was just some significant associations between eating disorders and compromised quality of life, but especially amongst those that had an IBS diagnosis as well. And so, although we could probably spend a whole webinar talking just about this, what I really think that this highlights is that when someone has an eating disorder and they also have stuff going on with their gut, it can impact their quality of life even more. And so it makes them just a more vulnerable population. And it's honestly a harder job for you as a clinician. And so, just something to be aware of, that when they have gut stuff going on, it's also going to just create a bit more complexity to the situation. But with the right tools, we can actually help these clients recover. So I really think that we can't ignore GI complaints when we're treating eating disorders, really at any level of care. I think sometimes we'll have clients maybe in the inpatient unit and think, oh, this is just a normal part of the process. And although this webinar is not specifically about inpatient, I want you to think about, how can we start intervention on this as soon as possible to help just the overall trajectory of treatment? We don't have to wait till someone is in outpatient treatment to help them with their GI complaints. And I'm going to give you just some ideas. So, really, we want to develop a toolbox. What's appropriate for what level of care? How can we support these clients? And I love, actually, I think that on Zoom webinar, I think Tamara mentioned that you can chat us, but you can't chat each other. But just for my own information, if you wouldn't mind, put it in the chat. I'd love to know what you do. I know there's probably a lot of dietitians here because I'm a dietitian, but I imagine we have nurses, we have therapists, we have doctors. I love to know a bit about what you do, because really a lot of this isn't just a dietitian's work. Although there's significant things that we can do as a dietitian, I believe it really takes the whole treatment team. So if you want to put in the chat a little bit about what you do, I would love to hear a bit more about you and what your role is, and so I can get to know you just a little bit and know who I'm talking to, since I can't see you. So let's see. A social worker in a college counseling center, therapist, dietitian, therapist. This is great. Psychologist, dietitian. I love it. Okay. Sorry, I didn't realize the chat was disabled, but I appreciate you all being here. I see some familiar names. So happy to see you. LCSW, inpatient unit counselor. This is awesome. Okay. So before you're like, okay, well, I'm not a dietitian, I can't do any of this. This totally applies to you. Regardless of what your profession is. And we really all have to work together. And I think the first step is understanding. So, first, we're going to talk today about some main GI complaints that our clients might have. Then, we're going to talk about some of the current research about GI and eating disorders and how they overlap. And then we're going to talk about how to address the main complaints. I have a couple case studies that we can walk through so you can see just how this actually plays out. So, that the digestive dilemmas that your clients have don't have to impact their treatment outcomes. The biggest thing that we're trying to do here is get the entire system working together. If you've been to any of my other webinars previously, you know that I talk a lot about the gut-brain connection. And although we're not specifically talking about that today, I do have to mention it because everything's connected. And so it's easy to think, okay, they have an eating disorder, put them in this box. They have IBS, put them in this box. They have this, put them in this box. But everything is connected, especially when we're talking about the gut, and specifically the gut-brain connection. And so we want some easy to implement strategies to help these common GI issues that occur in our population. So the first thing that I want to mention here is that the entire GI tract is a muscle. And if this is something new to you, I hope that this is exciting, because if you've ever been to the gym before, or you've ever used a muscle before, which is everybody in this room, we use our muscles all day long. I want you to think about this. Your GI tract is a muscle that can get out of shape easily in the throes of an eating disorder. When someone isn't eating as much as they used to, when someone is skipping meals, when someone is purging, when someone is taking laxatives, whatever is going on, the GI tract is a muscle, and if it's not being used, it's going to get out of shape. Just like if you broke your leg and you were in a cast, your muscle is going to atrophy over time. So the really, really encouraging part of this is if your client has GI issues, let's say they're struggling with constipation, they can't go to the bathroom, but more than maybe once a week, you can get that muscle back in shape. And this is a muscle that starts at your mouth and goes all the way to the end when you have a bowel movement. And so we have to think about the gut really as like the whole system, and how do we get the whole system back online? So some really, really simple interventions that can help from head to toe, just improving these outcomes. So let's talk about some of the main complaints and what we can do about these things. So again, not going to cover everything today because we only have an hour and Tamara will kick me off if I talk too long, but the main complaints, severe constipation or diarrhea. This is likely very common in the clients that you see. Stomach pain or nausea, also likely very common. Reflux, maybe less common, but still very common of a complaint, especially in the higher levels of care. And then bloating. What client have you seen that hasn't complained about bloating? Probably the number one complaint that you're going to get is bloating. So we're going to talk about that today. So how do these eating disorder behaviors impact this? So the longer the eating disorder goes on, the more likely we are going to have some GI issues from the restriction, from the purging, from whatever it might be. The longer the gut is not nourished, the longer the system is kind of offline, the more likely we have for some GI issues to occur. Reflux, how does that impact their eating disorder behaviors? Someone has reflux, they probably don't want to eat, right? They don't want to feel like their esophagus is on fire. They don't want to feel like, okay, I'm having all of these symptoms and, I'm getting kind of this negative feedback from the symptoms I'm having. Inconsistent bowel patterns. So maybe they, like I was saying earlier, maybe they only go to the bathroom once a week, or when they do, they have a lot of diarrhea. This is really, really common. They don't go to the bathroom for several days, then they have lots of diarrhea. This is actually the most severe form of constipation. It's called overflow diarrhea. Food intolerances. So they might think, oh, see, I just don't tolerate any of these foods, so this is why I need to eat 3 to 5 foods. These are my safe foods because these are the only things that don't give me stomach pain. And then poor motility. I have a visual that I'll show you in a little bit, but when we're eating less, our gut muscle is not working as much, and that can lead to really slow digestive function, especially as it relates to emptying the bowels. So why do these things happen, and what are the contributors to this? So one thing that we know, if you look up the American Gut Project, this is the largest study to date that we have on gut health. And what they found in this study is that the wider variety of foods you eat, the wider variety of bacteria that you have in your gut, and overall the healthier your gut is. So not to overgeneralize, but typically when you're working with an eating disorder client, especially if you're working with an eating disorder client that complains of GI issues, more than likely, again, I don't want to overgeneralize, they're probably eating a very restricted amount of food. They might stick to kind of the same 5 to 10 foods that feel safe to them. And we know that poor diversity of food leads to poor diversity of bacteria in the gut. As a result, this actually helps, or this prevents short chain fatty acid production. If you're like, what is short chain fatty acid production? We're going to talk more about this, but what you need to know here is going back to this gut-brain connection that I mentioned earlier, your gut and your brain are connected. There's a lot of messages being sent from the gut to the brain, from the brain to the gut. And the interesting thing here is actually about 20% of the messages going from the vagus nerve, from the gut to the brain, from the brain to the gut, it's about 20%. But there's 80% of the messages going from the gut to the brain. So I want you to think about a time where maybe you've had kind of like a gut reaction. Maybe you got an email from your boss, or you had a meeting you were nervous about, or something just kind of jarred you and your stomach hurt, or you were running to the bathroom. Think about how strong that reaction was. If that's only 20%, think about what the 80% is doing. And so just kind of setting the stage here, when your gut bacteria, the 2 to 5 pounds of bacteria that you have in your gut, when they consume fiber from our food, they produce something called short chain fatty acids. These short chain fatty acids are byproducts of fermentation in the gut, and they help with inflammation. They help with overall diversity in the gut. They help with so many things. And I'm going to show you a study in a little bit that talks about this, but we need short chain fatty acid production for the whole system to work. So lack of function to the system can happen. Stress about food can actually decrease gut motility. Nobody needs to digest their food if they're worried they're being chased by a tiger. I know I've done other webinars specific to stress, so I won't talk too much about that, but we have to work on the stress component, because the stress, I always tell our clients, the stress about food is worse than the food itself. If you're stressed about food, it does not matter what you are eating. The body is not worried about digesting it. It's worried about running away from that tiger. And so blood flow moves away from the gut, and we need blood flow for gut motility. And then migrating motor complex disruption is another thing. And so I have a video that I'll show you in just a second, but want to just point out some of the studies here, kind of connecting some of this. So this study on the left-hand side was about the role of the gut microbiome, immunity, and neuroinflammation in the pathophysiology of eating disorders. And so what they basically found in this study was just the interplay of the gut microbiome, the immune system, and neuroinflammation as critical factors in understanding just the underlying mechanisms of eating disorders. And so what we can take from this study is that the gut, immunity, and neuroinflammation do impact eating disorders, and that there's likely some therapeutic interventions that we can use, like focusing on gut health, to help this whole system that's trying to work together. The study that's on the right-hand side was looking at the microbiota imbalances and then anxiety in eating disorders. And what this study was connecting was the connection between imbalances in the microbiome, anxiety, and eating disorders, proposing that potentially could probiotics help as an intervention here. And so this study revealed that when we have imbalances in the microbiome, this could be at play with those with anxiety and eating disorders. And so we could potentially use probiotics as a therapeutic intervention for these clients. I have some studies specific to probiotics a little bit later, but just kind of setting the scene here. So I think we're really going to start to see a lot more studies like this. These studies, I think this one is from 2016 and this one from 2021. And so although the 2016 one is a little bit old in kind of the research world, I think what we're finding is we're not isolating things anymore. So I think we're going to find a lot more studies looking at how are all these things actually connected, especially when it comes to mental health and eating disorders. So here's the fun video that I wanted to show you. So this is the migrating motor complex. If you've never heard of the migrating motor complex before, Your migrating motor complex is essentially like your after office hours cleanup crew. So after you've left the office, this is the crew that comes in and takes out the trash and cleans the desktops and wipes down the windows or whatever it might be, vacuums. You have an intestinal cleanup crew. And one of the disruptions that we typically see when it comes to eating disorders is this migrating motor complex disruption. The migrating motor complex shows up about 90 to 120 minutes after someone eats. And so, just kind of want to mention this, especially with those of you working at higher levels of care, when your client is eating so frequently, that can actually be part of the GI issues. And I know that it's an interesting balance of course, number one, we have to meet their nutritional needs. That's first priority. But also, how can we help to improve some of these GI issues? When you actually space out meals, it allows just this reset to the gut, fluids flush through, and actually help to induce a bowel movement and get things where they need to go. And so we see a lot of migrating motor complex disruption in the eating disorder space due to having to eat more frequently, and what is the balance there? And I think for every client, it's going to be a little bit of a different answer. But one strategy is trying to space out those meals, making sure your client can meet their nutritional needs, of course, first. But how do we space out meals to give the gut a rest, so that someone can have easier bowel movement? So, just wanted to provide this chart. I know you all have access to the slides, but you can screenshot this or whatever. But these are typically some of the symptoms that we see at all levels of care. So, inpatient, you're going to see a lot of different symptoms: lab work being off, migrating motor complex disruption, food refusal, maybe not constipation as much, but acid reflux, diarrhea. Residential, you're going to see quite a few symptoms as well. Day treatment, outpatient, and really, like, honestly, all of these could be checked for all levels of care. But these are the most common symptoms and things that are occurring at each level of care that you might just want to be aware of. And I'll give you some tips later on how to address them, especially depending on where you're working. So, where do we actually start? So, I want to give you 3 tips today to implement for your GI clients. And the first one is to improve prebiotic intake. So, I set the stage earlier talking about your gut bacteria and short chain fatty acid production. One thing that we typically see, again, I don't want to overgeneralize, but the one food group that many of your clients avoid is carbohydrates. And the problem with this is that many carbohydrates contain fiber. Many carbohydrates also contain prebiotics. I think across the board, most clients that struggle with eating disorders are going to avoid foods that may make them feel bloated or may contribute to some of these GI symptoms. And prebiotics will do that if you have disruptions in your gut. But there are ways to introduce them without having so many symptoms. And so, from the research, we see that when someone has diversity of bacteria in their gut, this actually improves their short chain fatty acid production and improves their gut brain connection. It can improve mood and so many other things. And so, one simple thing that we can do is improve prebiotic intake. And I'll teach you how to do this. But as I mentioned, restricted diets slowly diminish the bacterial population in the gut. And like I said earlier, the more variety, the better. And your bacteria in your gut, so those 2 to 5 pounds of bacteria that you have, these trillions of organisms in your gut, they have a huge say in mental health. They have a huge say in even skin health. So many different things are being connected back to this. And the number one way to make sure you don't have a lot of bacteria in your gut is to restrict your diet. And we see this all of the time. So we want to work on how do we actually help these bacteria to survive in the gut. I think a lot of times we think, what's the probiotic that someone needs to take to fix their gut? But a probiotic is really going to be a waste of money if someone's diet doesn't support that probiotic actually living in their gut. So it's easy to jump to like, take this probiotic or take this strain or do this thing. But we have to look at, does the diet actually support this? And more than likely, it doesn't. And so, how can we actually add in some of these prebiotics? So, of course, you can get prebiotics from foods. You can get them from asparagus, from onions, from garlic, from on the greener side, bananas, from oats. So many different foods have prebiotic fiber in them. But a stopgap that might be really helpful for many of your clients is slowly introducing some prebiotic fiber. You can even do this through a tube feed. Obviously, clear this with whoever you're working with, but to help that bacterial population in the gut flourish. So, low and slow is the motto. More is not better. And especially if you're trying to build trust with your client, low and slow is definitely the motto. And so we want to start with sun fiber or acacia fiber, mostly because these are less likely to cause bloating and some of the GI discomfort. And this directly impacts the gut brain axis. And so, as we introduce some of this prebiotic fiber, we can help flourish the bacteria in our gut. We can help with short chain fatty acid production, and we can help our clients to feel better. And so, these are just some general recommendations for dosing. Typically, week 1, you're going to want to do a quarter dose. So, whatever it says on the package, if you're using sun fiber, this is like a quarter teaspoon. Week 2, you would increase it. Week 3, we've had clients go even slower than this. So it's really, again, there's no rush. You don't have to start with the full dose right away. And it might take 2 months to get to the full dose, and that is okay. But what you should notice is fuller stools, more formed stools. You should notice that maybe an increase in frequency of stools as their body gets the fiber that it needs, or as their gut really gets the fiber that it needs. Then you can introduce more fermentable prebiotics like FOS, GOS, and ZOS. Those are our more fermentable prebiotics. You'll find those in a lot of prebiotic powders. I know in the age of Instagram, everybody is selling some kind of like gut powder, this thing, that thing. And if you look on the back and it says, galacto-oligosaccharides, there is a potential that that is going to induce more bloating or GI discomfort if you start there. But it can be easy to build on that if you start with sun fiber or something that's a little bit less fermentable in the gut. So just want to kind of drive this point home. So your client starts and has a restricted or limited diet. Maybe they've been told by another provider to do low FODMAP. We actually have a client right now, and it's so heartbreaking. She struggled with an eating disorder in high school, recovered, and then started getting a bunch of GI symptoms. This is something that we see a lot. She went to college, was doing really well. A lot of the stress and anxiety of college has contributed to tons of IBS-like symptoms. She started seeing a dietitian who immediately recommended that she go on the low FODMAP diet. And then what she told me, and it was so heartbreaking, is every time she went in to see this dietitian, she just cut more foods out. And I hate that that was her experience, because that was really not going to help her. She had already started cutting out tons of foods just on her own, as probably many of your clients do as well. They see things online, or they Google like what not to eat to be bloated or whatever it might be. And they slowly start kind of weed whacking foods throughout their diet. And this poor client is now kind of in this place where she's eating so few foods. She's more anxious than she ever has been. And it's just this super vicious cycle. And I'm sure many of you can relate to that with clients that you've seen. So this restricted or limited diet decreases the bacterial population in the gut. We want to have a diverse population. Like I mentioned, this decreases short chain fatty acid production. So the byproducts of fermentation. So your prebiotics, feed your probiotics, and they create short chain fatty acids. And then this impacts the gut brain axis. So it can contribute to neuroinflammation, anxiety, and all sorts of stuff. And so we're trying to prevent this from happening. So how can we add in some more prebiotics first to feed these bacteria and help increase the population in the gut? And that's a super simple strategy. We can also improve microbiome diversity through polyphenols. These are a specific type of plant compound. You find them in lots of dark red and blue foods like cherries, blueberries. You even find it in like green tea. So polyphenol rich foods. A resistant starch is another way. It's not a prebiotic, but it acts like one. And so when you cook and cool starch, so rice, for example, you make a pot of rice, you cool it. Even if you reheat it, it maintains the resistant starch. This acts like a prebiotic and feeds or encourages the growth of your good bacteria. And then what we found from that large study that I was talking about at the beginning, the largest study to date, is that the kind of benchmark is 30 plants per week. I don't know that this is a recommendation that you would necessarily share with your client, but really we're just looking at how do we get diversity. And when I talk about plants, I'm not just looking at fruits and vegetables. We're looking at whole grains, nuts, seeds, beans, legumes, herbs, spices. So many things are classified as plants and can help just encourage this healthy microbiome. So we really want to prioritize the production of short chain fatty acids for reducing inflammation in the gut, reducing inflammation in the brain, helping to improve gut motility, improving that gut brain communication, and then overall improving symptoms. That's kind of the overarching goal. Okay, step number 2 or solution number 2 is improving digestion. Maybe easier said than done, but there's lots of really simple things that we can do to improve digestion. And that actually starts before someone actually puts food in their mouth. It starts with what they're thinking about food and their meal hygiene, like we like to call it. So, not what you eat, but how you eat. Is someone rushing through lunch and eating while they're on their computer? Are they watching TV? What are they doing? How are they relaxing before they eat? This is going to help signal to the body it's okay, it's safe to digest this food. We have so many examples of clients now who maybe eat the exact same thing, but the scenario is different and they were stressed in one scenario and not stressed in another. Super bloated after eating, not bloated after eating. So sometimes it's communicating to your clients like, I really don't think it's the food. I think it's the stress that you're going into the meal with. So how can we relax? Can we take 2 deep breaths? Can we hum happy birthday twice? That's a tool that we give to our clients, whatever it might be. Bitters are great for stimulating digestion. This is a tool that you can use, digestive bitters. There's lots of different brands. Some of them are in an alcohol tincture, and there are some that are non-alcoholic. And so if that's a concern, you can find some that are, but they're amazing at stimulating the whole digestive process, because remember, digestion starts here. And when we're stressed, that's going to shut down the rest of the system. So the bitters can help encourage stomach acid production, bile flow, pancreatic enzyme release. And so can be a great just kind of reminder to the body, okay, we're getting ready to digest a meal. They can also be great for symptom relief like bloating and gas as well. Improving gut motility and getting the bowels moving. We'll talk about that. And then reducing stress before meals. So just some really easy, simple tips for symptom relief. We use a lot of these with our clients, especially while we're working on really identifying what's the root cause here. So for acid reflux, and this is on your quiz, I know this, but like Tamara said, there's some clues at the end. Saccharomyces cerevisiae is a specific strain that is helpful for acid reflux. Slippery elm chews or tea can be really great for drinking after a meal. If someone has acid reflux, DGL plus So this is a deglycerized licorice. It doesn't have an impact on blood pressure. You can do 1 to 2 caps before meals for just any kind of acid feeling. Or aloe vera, you can get a teaspoon of the fresh inner leaf gel is what we're looking for before meals to help reduce symptoms of acid reflux. And these are just tools that you can use to help maybe with meal compliance. That's a big one I know that we talked about at the beginning. And then bloating, like I mentioned, probably the number one complaint that you're going to get. And I it's hard with bloating. It's a hard balance because in my experience, typically bloating is the last symptom that we see to improve. If someone is not going to the bathroom every day, they're having acid reflux, whatever it is, we have to get everything else working before the bloat goes away. And just kind of being candid with you there. So bitters, like I mentioned, are great for kind of that like gurgly stomach. And then fennel tea is great for gas relief as well. Okay, solution number 3 is to improve gut motility. So you can see this little ball here slowly going through the gut. Most of your clients that struggle with constipation likely have a motility issue. So when I'm talking about motility, I'm talking about the contraction of the gut muscles. So back to what we talked about at the beginning, your gut is a muscle. It has to get back in shape. And so we have to encourage it to get back in shape. And there's many things that we can do. But if motility is slow, this can lead to lots of bloating, lots of gas, lots of trapped gas, infrequent bathroom trips, etc. So when Reglan, Motegrity, whatever the medication isn't working, or it's totally flipping them the opposite way. I know we see this a lot. Someone starts Linzess and they're like, well, now I have liquid diarrhea and I can't leave my house. And so what's the balance here? How can we actually improve gut motility? So I want to talk about just a couple more studies specific to gut motility and IBS and methane production. So this might be new to you, or maybe you've heard me talk about this before. But this study that's on the left-hand side is specifically looking at IBS and higher methane production. This is not specific to eating disorders, but essentially what this study is suggesting is that those with constipation predominant IBS have an abundance or higher amounts of a specific type of bacteria called Methanobrevibacteria smithii. And that is a huge mouthful. We call it methane in our practice, or methanobacteria for short, but methane slows gut motility. And so that's something that we want to keep in mind is, does someone have higher methane producing bacteria in their gut? Is that slowing everything down? And then is that kind of starting that vicious cycle? Slower gut motility, lack of desire to eat, lots of uncomfortable symptoms, et cetera, et cetera, et cetera. And so how do we intervene here? And then this next study on the right-hand side is looking at the gut microbiome specific to anorexia nervosa and looking at just the potential impact of microbial composition and how potentially there's some utilization of how do we actually look at the composition of someone's gut and how do we intervene? Are there specific bacteria that are present in someone who has anorexia nervosa? And what does the nutritional rehabilitation look like? One thing that they mentioned here, just in the abstract, is how typically when someone is trying to is on a weight restoration plan, they're looking at elevating fat content in the diet. But how do we actually introduce some higher fiber foods to help with exactly what I was talking about earlier, this changing the makeup of the gut? So what's the balance there? And maybe it's just adding a little bit of prebiotic fiber to start. So how do we get the bowels moving in the meantime? Because methanobacteria or an increase in methane gas production can be a really tricky vicious cycle because you're slowing down the gut with this specific bacteria and then it can cause the creation of more of it. And so solution is, let's get the bowels moving first. So one thing that you can try is ginger. Ginger is amazing for gut motility. You can take capsules, you can drink tea. Typically, we're looking at 1 to 2 grams per day. We typically have our clients take the capsules like an hour before bed. And this actually helps the contraction of the gut muscles and encourages gut motility. And it's not something like a laxative that is going to cause dependence. It's still forcing the gut to contract as far as like getting it back in shape. Another option is triphala. In my opinion and experience, this doesn't work as well as ginger, but it is an option. Okay, last study that I want to share with you is specific to spore-based probiotics. I wish I could like do show of hands and see who has heard of spore-based probiotics, but this study that's on the right-hand side, disclaimer here is there's a large supplement company called Microbiome Labs. You may or may not have heard of it, but they sell the only, as far as I know, the only 5-strain bacillus spore-based probiotic that's on the market. You'll find spore-based probiotics from like Just Thrive or other companies, but they don't have all 5 spores. They'll have 3 or 4 of them, but not all 5. I think Microbiome Labs owns the patent on it, but don't quote me on that. But essentially, what this study is looking at is how spore-based probiotics, specifically those containing the 5 strains of bacillus, how it actually changed the composition of the gut for the better. And so what they're concluding from this study is that taking spore-based probiotics can be a helpful tool in shifting the composition of the gut towards a quote unquote healthier gut. The disclaimer that I was mentioning is that this study, the founder of Microbiome Labs, is listed on this study. So take it for what it is, but there are many other studies that you can look at related to spore-based probiotics. And we've seen this a lot in our practice. Spores have been amazingly helpful for so many of our clients, and they can be pretty hard to tolerate at first. So there are strategies for actually introducing them and introducing them in a way that doesn't cause your client more distress. But spore-based probiotics can definitely change bacterial balance. Polyphenols also, like I mentioned, act like prebiotics, but aren't prebiotics, but they can help encourage the growth of beneficial bacteria, and they can actually lower methane levels. There's a GI doctor that's pretty well known in the Dallas area where I am, Dr. Brown, and he founded a product called Atrantil. And it's actually specifically targeted towards lowering methane levels because he was seeing a lot of his SIBO clients struggling with not being able to get rid of the methane. And so that can be a polyphenol supplement tool. Prebiotics, like I mentioned, and then resistant starch is another way. And really, like these go together. Spore-based probiotics need fuel just like any other probiotic as well. So you want to make sure you're doing all of them together. Okay, I think we have time. Yes, we do. Yay. Okay, so let's do a quick case study. So this is a client, 26 years old, identifying as she, her, history of anorexia nervosa for 10 plus years, very limited diet due to food fears, fear of weight gain. She's been diagnosed with reflux and gastroparesis. Following the meal plan is extremely difficult for her due to stomach pain, constipation, and reflux. We've all heard this story before. Her weight is not yet restored, so the meal plan does have to be significant in order to meet her caloric needs. So what are some potential things that we can do? Number one, I always like to look at how is the client eating? What is going to be supportive for them? Meal hygiene. Are they relaxing before meals? Maybe this is a group activity where we literally as a community just take 3 deep breaths before we eat. Sounds silly, but it really helps to just signal to the body, I'm safe, I'm okay. Or maybe it's just saying that out loud, I'm safe, I'm okay, to prevent the body kind of going into this fight or flight and shutting down all of digestion. Spore-based probiotics and polyphenol support could be a potential solution as well, especially given her history of 10 plus years. I imagine her bacterial population in her gut is pretty restricted. Obviously, don't have data on this specific person, but if we were to look at some testing, potentially that would be the case. For reflux, we have lots of different options, but we could use DGL before meals. We could use aloe to help improve the symptoms, to help maybe increase compliance and help her to maybe meet the meal plan. Bitters after meals for any kind of digestive discomfort. If needed, I didn't talk about this, but thought I would throw it in here. We could use something like magnesium citrate to help with the constipation, to get her bowels moving so that we're not just creating this vicious cycle of everything's kind of stuck and slow in the gut. We're increasing methane production, slowing things down even more, decreasing compliance, blah, 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 from there. Just some other things to consider would be maybe some ginger for gut motility. Because she's at residential, maybe this is part of her meal plan, like she drinks it with her meals or in between. In the groups, and sun fiber. Maybe she adds the sun fiber to supplemental shakes. This is really easy to mix in. It doesn't change the taste. It's not chalky. It's a very easy implementation there. Okay, one more case study. I know I'm going fast, but I want to make sure I have time for questions. So last one, 36-year-old identifying as he, him, admitted with a history of an eating disorder since his late teens. So 20-ish years, began as a restriction, but has morphed over time to bulimia. Issues include slow gastric emptying and significant reflux. Weight is restored at this time. So what are some things that we can do? We can look at dietary diversity. Is he eating enough prebiotic fiber? If not, you could use sun fiber or some kind of prebiotic fiber to help start improving the gut bacterial balance. Definitely working on stress management. I think that's kind of across the board for every person on this planet. Meal spacing, because he's weight restored, you can maybe implement this, but you know that like 3-ish hours in between meals can be super great because it's going to help the migrating motor complex to show up and help, especially with that acid reflux. So assessing for gastritis, just due to the bulimia history, we see that quite a bit. You can try the DGL before meals. Even if he has gastritis, that's totally safe. You can trial bitters before, after meals. Just in like caution, if he does have gastritis, I would use alcohol-free bitters just to make sure we're not causing any kind of issue. It's a very low amount, but still I would just err on the side of caution there. Okay. So, ta-da, this is our surprise at the end. So nobody is stressed about the quiz answers for your CEUs. So you have access to all of this. So no stress here. And if you're interested, I have a free digestive health checklist. So kind of like where I'd start walking through, you know, before adding any other interventions, here's kind of the steps that I would take. Here's the steps that I would take for these specific things. So if you want access to that, if you think it'd be helpful for you as you're working with some of your eating disorder clients, you are welcome to download it. You can go to this QR code or you can just enter this in your browser and you will be emailed the checklist. So Tamara, did I do okay? Are we good on time for questions?
You did awesome.
Yay.
And yes, we have some time for questions. It's clear that we're not going to get to all of them. And in fact, I apologize to those of you who typed questions in the last 5 minutes because I couldn't respond. They were coming in so fast. So just know that I see them and we'll try to get to some. Heather, before we do that, I just want to remind everybody, I know we have lots of clinicians on the line and some folks might need to hop off at the top of the hour. We'll likely go a couple minutes over that. So if you need to hop off, that's okay. Keep in mind 2 things, that when the webinar ends, or if you leave a few minutes early before I end it, you will see that there's a survey that will pop up on your screen, and it will be in the same tab that you're currently in. That's a continuing education requirement for us. That's a survey about how we did on the webinar. If you take just a minute to fill that out, we would really appreciate it. Those responses are completely anonymous, so feel free to be candid in your feedback. And then we tabulate those results, send those to the CE approval entities. And then also as you leave, or when I end the webinar, you'll see that there's a link to take the post test that will pop up in a separate browser tab. So keep an eye out for that. You can click on that link. It'll take you to the test site. Once you pass the test online, then your CE certificate will be downloaded, or excuse me, will be available for download once you pass the test. And then tomorrow, if you don't have a chance to get to it today, that's okay, because tomorrow you'll get a follow-up email, and in that email will also be the link to take the test if you haven't already done so. All right, Heather, let's get into some questions. We had multiple questions about the medications. I think they're GLP-1s, so like Ozempic and there's semaglutide, right? Asking about, the symptoms that those can cause, a buildup of gas, and does it slow the process of the gut? Can you speak to that at all?
Yeah, honestly, that could be a whole webinar in itself. I'm
Right?
sure there are webinars on this. I just don't know anything off the top of my head, but yes, the GLP-1 does impact the gut, and what we see is it does slow down the gut. So we have actually seen in our practice quite a few people that have taken this and then really struggled with pretty severe constipation. Obviously, I'm seeing the more severe end of the spectrum, but it does slow the gut, and it does have interactions with the gut because it is acting on a gut hormone. So it's everything's connected there.
Great, thank you. We had a question from Zohal, I think. I apologize if I said that wrong. The question is, when you recommend spacing out meals in reference to the after hours cleanup crew, how far apart should meals be? I think you referenced 3 hours, but I just wanted to make sure everybody understood. Is that correct?
Yeah, 3 to 4 hours. I understand that for an eating disorder client, 4 hours is probably a stretch, but
Right.
three-ish hours is typically what we recommend our clients. And there's a couple criteria, one, like I said, meeting their nutritional needs, number one priority, balancing and keeping blood sugar stable, also number one priority or number two priority there. So if those things can happen, then I would consider slowly spacing out the meals so that cleanup crew can come through.
Thank you. Ronald asked, what about the neurotransmitters located in the GI tract, such as dopamine and serotonin? Where are they located in the GI tract? Are they in the small intestine, the large intestines, etc.?
Ooh, that's a loaded question.
Right?
So neurotransmitters are like located and produced in the gut. And so it's going to depend on each neurotransmitter. But yeah, there's not really a short answer to
Good.
that. But yes, they're produced in the gut. They act on the gut brain axis. And so I think also there's going to be a lot more studies too on that specifically, as well as like how do we boost serotonin production in the gut, as a treatment intervention as well.
Thank you. Gina asked and Tony asked, they were asking similar questions when you were talking about sun fiber and acacia fiber. What's the complete dose of acacia fiber, and is it daily dosing when you were referencing that?
Yes, good question. So typically you're looking at 1 to 2 teaspoons as a dose. And yes, you would definitely want it to be a daily dose. So just like, we eat foods every day, our bacteria need foods every day as well. And so ideally you want to take it every day. That being said, we have had clients that they just couldn't really tolerate much more than like every other day for a while. So we're starting like super slow and maybe skipping some days in there as they work on building up their tolerance. And really, kind of the reason for that is your gut bacteria actually digest fibers for you. So if you think about someone with like a super diminished gut bacterial population, like the clientele that likely all of us are seeing, they're going to have a harder time digesting those fibers because they just don't actually have the manpower to do so.
Thank you. You referenced, this is from Fabiola, you referenced bitters several times. Can you give some examples of bitters? I think there are some folks who aren't sure exactly what that is.
Yeah, so bitters are extracted from bitter foods and herbs. So you might see like orange peel, you might see like dandelion. Every bitters tincture. Usually they come in like a little bottle. Every bitters tincture is going to be a bit different just as far as the formulation. Even like arugula is a bitter. So we've had clients that like eat arugula, before meals to help kind of encourage that bitters encourage salivation, which then just encourages the whole digestive process. So there's lots of different brands. Earthly is one, Urban Moonshine is another. You can find them from lots of different companies.
Thank you. A similar question about supplements. Are bacterial supplements from the internet, quote, or in parentheses, not refrigerated, okay? Or where should they be found?
Yeah, this is a great question. So if it's a spore, it doesn't need to be refrigerated. And there's a lot of debate in the probiotic world about like, well, if it has to be refrigerated, then it's not actually going to survive the acidity and heat of the stomach, which in part makes sense. And so spores do not have to be refrigerated. I wouldn't buy any spore from the internet. I would make sure you're buying it from a really good company because there's lots that I would not buy. But in general, if it's a spore and it's not refrigerated, that's totally fine. It doesn't have to be refrigerated.
Thank you. Alessandra asked, if someone has constipation and a high tolerance to laxatives or laxatives do not work, would you start with a higher dose of ginger tea / capsules, or is there another therapy you can use co-intermittently? I think that's not the right word, so I apologize.
No, that's okay. I think I understand the question.
Oh,
So
good.
I wouldn't, just because you don't know how someone's going to respond to anything, and you can always titrate up the dose, but I'd rather not lose trust with my client by like making them swing the totally opposite way. So I'd still start with like 1 gram a day and see how it goes for 3, 4, 5 days, and then you could always increase it from there. Much more than 2 grams of ginger. I mean, ginger is a spicy herb. So if you take a lot of ginger at once, it is going to be kind of spicy. So you could either space it out if you want to, or try something else in combination with it. We've had some clients do ginger and triphala together, but typically the combination that we're doing is ginger and magnesium to help draw water to the bowels and then contract the bowels. So you're kind of doing two different things with both of those together. Uh-oh. Tamara, you froze.
Uh-oh, you froze too. Am I back? Are you back, Heather?
Yeah.
There we
Yeah,
go.
you're
Okay.
back.
Sorry, it's a question from Suzanne. How do you handle caffeine recommendations with these clients?
Ooh, that's a good question.
Yeah.
I think it's so individual. I mean, so many clients notice that their anxiety increases with caffeine, but then you also have the clients that are like, I have to drink coffee to go to the bathroom. So I think it's just a balance of we don't want to be reliant on the coffee to go to the bathroom. We also might want to find another solution if it's increasing your anxiety. But I mean, typically we're recommending like 1 cup of caffeine or less if possible, if they're super reliant on caffeine for whatever reason.
Thank you. The good news for everyone is that we get Dr. Finley back next month to do a second webinar for us on February 28th. So if you're not already registered for that, please join us. We'd love to have you back with us again. We're so lucky to have Dr. Finley with us and thrilled that you all could attend with us today. We thank you again for your time. And as I said, watch for two things when I end the webinar, the survey, and then in a separate tab, the link to take the post test for CE credit. So thanks again to Dr. Henley. Oh my goodness, I'm having a hard time. Thanks again to Dr. Finley for being here and for all of you to be here. Take good care. We'll hopefully see you next month. Bye-bye.
Thanks, everyone.